Welcome to another episode of the News Roundup. On today's show, we're going to be discussing the proposed amendments to the Pandemic Treaty, which would give a much more assertive role to the WHO and oversight and enforcement through the International Health Regulations, otherwise known as the IHR. And we're going to be bringing on a guest, Shabnam Palesa Mohamed, who will be discussing what is going on here. And so, from Trial Site News, I am Adrian, and our episode is starting right now. So the World Health Organization, otherwise known as the WHO, through the International Health Regulations, is in the process of being given more authority over people's health. Now, as we here at Trial Site News previously reported on this development back on April 6th of 2022, the question has now been raised. Does this represent a global power grab or simply a rational measure to better synchronize national health agencies? Well, let's discuss. To answer this, let's look at the International Health Regulations. The IHR requires countries to detect, assess, report, and respond to public health events. Their scope includes travel and trade monitoring that may restrict inter-county travel or trade based on approved regulations. In December 2021, the U.S. pushed its amendments onto the WHO member states, disregarding and not being on equal footing with the amendment proposals of other countries. The U.S. proposal contained the following: acceleration of information sharing to and from the World Health Organization, sharing of genetic sequence information, compulsory acceptance of the WHO's assistance in collaboration in preparedness and response, opening of outbreak sites for international assessment, and promotion of multi-stakeholder approach. This proposal also did not address the concerns of developing countries regarding financial and technical assistance to comply with the proposed amendments. After all, expecting low and middle income countries, or LMICs, to ramp up to the technical capacity of rich nations is hardly rational, let alone fair. So the TWN, or the Third World Network, an independent nonprofit international research and advocacy organization in Malaysia, reported that the call for developing countries to adopt a timeline and process for submitting proposals to the working group on strengthening the WHO preparedness and response to health emergencies was not recorded in its summary report. The WGPR seems to be putting more importance on the interests of the US for the proposal over other developing countries. This according to the TWN. In addition to the amendments, the World Health Organization is currently drafting and negotiating a pandemic treaty. Now, this pandemic treaty was proposed by Charles Michel, the president of the European Council, back in November of 2020. Now, in February of 2021, EU leaders agreed to work on an international treaty on pandemics. And so a consensus was then reached in December of 2021 to start the draft and negotiated convention under the World Health Organization. The Intergovernmental Negotiating Body, or the INB, was then constituted and held its first meeting in March of 2022 to agree on the ways of working and timelines. And the second meeting will be happening here soon to work on the amendments for the treaty. So what does the pandemic treaty aim to do? Well, they state that they are here to ensure higher, sustained, and long-term political engagement at the level of world leaders, of states or governments. They want to define clear processes and tasks, enhance long-term public and private sector supports at all levels, and foster integration of health matters across all relevant policy areas. It would also support and focus on early detection and prevention of pandemics, resilience to future pandemics, response to any future pandemics, in particular by ensuring universal and equitable access to medical solutions, such as vaccines, medicines, and diagnostics, and a stronger international health framework with the World Health Organization as the coordinating authority on global matters. And this would also include the One Health approach, which the idea would be to connect the health of humans, animals, and our planet together as one. Now, the proposed benefits of this would be, well, better surveillance of pandemic risks, better alerts, better response, better access to health supplies and services, research and innovation, better response mechanism, better implementation, and restoration of trust in the international health system. But would this really be the case? Well, according to Julian Savulescu, director of the Oxford UHIRO Center for Practical Ethics at Oxford University, mandatory COVID-19 vaccination can be justified when, quote, there is a significant threat to public health. Savulescu states that such a mandate can be imposed when there is a high chance of people harming others and meeting the following conditions. First, you have a grave threat to the public. Second would be the vaccine is safe and effective. 3, mandatory vaccination has a superior cost-benefit profile compared with other alternatives. And 4, that the level of coercion is proportionate. Now that's interesting. However, the European Parliament has expressed its concern about democracy and the rights of its citizens that might be affected by the decisions made by these authorities, which falls in line with voiced concerns and protests over human rights. And such concerns are still ongoing as governments manage and address the global situation. So the question is, are authorities violating people's rights by giving themselves greater power? It would seem so. And is it somehow okay for the rights of people to be stripped momentarily for the greater good? And so, here to talk with us about this upcoming World Health Organization meeting in Geneva, I am pleased to bring on Shabnam Palesa Mohamed, a journalist and contributor to Trial Site News, lawyer and activist, and host of the Trial Site News Africa show on trialsitenews.com, and also available at Trial Site News on Rumble, as some of the topics that she covers are unfortunately too hot to handle for YouTube's rules. So be sure to check her out there. So Shabnam, welcome to the show.
Thank you, Adrian. It's wonderful to be in this conversation with you. And I'm really very proud that Trial Site News is tackling this very important topic.
Well, I'm thrilled to have you here. You've done fantastic work. It's been wonderful to follow. Now, Shabnam, I read your article back on May 12th on the World Health Assembly 75. And this is why I wanted to bring you on the show today, because it's set to vote on sweeping decisions for health and sovereignty. And in your report, you focused in on the issues of weakened sovereignty, increased surveillance, and so on and so forth. So can you talk about what you are seeing here?
So the World Health Assembly number 75, which takes place from the 22nd to the 28th of May, essentially on our doorstep, is where there's going to be made a unilateral decision by representatives or delegates of countries on amendments to the International Health Regulations 2005. Little bit of context. These amendments to the existing regulations have come out of a Department of Homeland and Health Services in the US, which essentially have made far-reaching and what many call a power grab amendments to the existing regulations. And as you've mentioned, some of these regulations include giving unilateral power to the Director General, currently Tedros, probably due to be re-elected unopposed, to declare a public health emergency of international concern. Now, prior to these amendments, the regulations used to say that he would have to consult with the member state that is affected by a public health emergency. Now, the amendments do not make it necessary for him to consult with the state that's affected. It also says that he can declare a public health emergency even where there's a potential public health emergency or infectious disease outbreak. So not if there is, but there is a potential outbreak. And of course, this has serious ramifications for the sovereignty of a country who may not genuinely believe that they actually have a public health emergency of international concern. And we know that pandemics, in inverted commas, because the definition has changed, can be used as instruments of geopolitical maneuvering, engineering, and politicking. Some of the other amendments, Adrian, that are of serious concern, and there's 13 amendments being made to the IHR 2005, include greater biosurveillance, include giving the Director General of the WHO and the entire machinery there the ability to give an affected country or who they perceive to be an affected country 48 hours to respond to an offer for assistance. Now, that is not workable in the real world, and certainly not in countries that have the infrastructure to be able to do so. And if they don't respond, they will be reported back to the other member states. And what they could be looking at them is potentially sanctions against that country for not complying or towing the line. Some of the other highly controversial issues in these particular amendments is that the WHO can accept information from secret sources. So it's not important for them to disclose where they got the information from. And I think it's quite easy to see how that can be used to manipulate a situation. And of course, weakened sovereignty, where, as I mentioned, there's no need. So the amendment says the Director General may consult with the WHO Emergency Committee as to whether there is an actual or potential health emergency, not must. So he doesn't have to do it, he may do it. And so that replaces, of course, national sovereignty. One of the other important amendments I want to highlight, and there's 13, as I mentioned, is under Article 59 of the amendments. A member state now has 6 months to reject amendments to the IHR. Prior to these amendments, member state had 18 months. So we're looking at between May 22nd to 28th until November this year to either reject or provide what is known as a reservation to the amendments to the IHR. And any rejection or reservation received after that period shall have no force and effect. So this is groundbreaking. It is extensively seen as a power grab. The World Council for Health is taking a lead on this, together with many other excellent organizations around the world who are saying this is a power grab, utilizing the coronavirus episode or chapter as a means to achieve a top-down global architecture on health, on personal autonomy, and on the sovereignty of nations.
Right. And even if you believe that their intentions are good, you're still opening the door for all sorts of corruption down the road. I mean, it seems problematic on its face, no matter how you look at this, whether you think it's a good idea or not.
Absolutely. I mean, the WHO, and this is not just now during the coronavirus chapter, but historically has a reputation for mismanagement and corruption, and of course, conflicts of interest. Starting off first with the fact that 80% of its funding comes from private sources who have a stake in the decisions that the WHO makes. Many of its committees have members who have patents, for example, and then are not capable of making decisions free of conflicts of interest. This has been a subject of debate for many, many years, but not much has changed because the WHO is poisoned at its root from conflicts of interest, corruption, and mismanagement. In fact, there was a journal article in the Journal of Integrative Medicine and Therapy, which stated that the corruption of the WHO is the biggest threat to world public health of our time. And this is rooted in evidence if you look at WHO drug recommendations, in particular on repurposed medicines, but also on its obsession with pushing only the jabs as a way to get the coronavirus, as let's call it situation, if not pandemic, under control. And of course, if you look at documentaries like Trust Who, it's an excellent documentary to watch. You'll see the former Director General of the WHO, Margaret Chan, specifically said that they have to go out with a begging bowl, asking for contributions to be able to run this entire superstructure. And that brings me to the other point, Adrian, which is that amendments to the IHR or the new pandemic treaty, which we won't talk about too much now, we can do a follow-up interview, equally important, but we have a bit of time with the new pandemic treaty. We're focusing on the IHR, would mean that countries would need to pump even more money into the WHO, essentially this black hole where money and resources just disappear, never to be seen of again. And that money should rather be used into building the health and infrastructure of sovereign nations and building parallel systems for healthcare. It's quite evident if you look at how the WHO has performed over the last 2 years, just looking at that it's been an abject and utter failure. And there's so many criteria within which we can judge exactly how it's been a failure on issues of efficacy, repurposed medicines, adverse effects from the jabs, disinformation and misinformation, the censorship of important voices on topics that need to be heard. And so I think the WHO and by extension, the United Nations and the World Economic Forum have grossly miscalculated with these IHR amendments and the new pandemic treaty. What's going to end up happening in my analysis is that member states are going to not only pressurize the WHO to take back these amendments, but also may consider withdrawing and defunding the WHO and establishing parallel systems for healthcare.
That would be a very fascinating approach to this, and it would be interesting to see the fallout on that. Now, I also want to talk to you about the one-size-fit-all approach. Can you talk to us about that as well, and why that would be problematic?
Well, it's highly problematic because it positions the WHO, which is now using this one world, one health slogan repeatedly, as the ultimate guide, the ultimate decider of all decisions regarding our healthcare. So it would not be within the domain of perhaps national health ministers, but the WHO, which is an unelected organization, and then I've mentioned previously, which is fraught with issues to make decisions about healthcare, not only in terms of pandemics or infectious diseases, but everything. They could decide obesity is now a public health emergency of international concern and tell you how you need to run your country, perhaps tell you that genetically modified organism food is healthier for your country than fresh, organic, non-chemically infected food, and you would have to enforce that. And so we certainly don't agree that the WHO, I certainly don't, as it is funded by Big Pharma and highly conflicted, should be making any decisions about healthcare. Its role was meant to be a guide. Its role was never meant to be an authoritarian dictatorship, which essentially tells sovereign countries how to run health in their country, or else we will punish you by sanctions, by censorship, by disinformation. And so I really think that one of the most important focus points of what we're dealing with currently with the upcoming World Health Assembly, Adrian, is that no one knows who the delegates to the World Health Assembly are. Again, this top-down One Health approach. If you look and research, and one of my colleagues is James Rogaski, if you look at his Substack or go to don'tyoudare.info, you'll find a lot of information there about the work that he's doing in terms of research in the WHO, the IHR, and later the new pandemic treaty. And you'll see, if you look at the list of delegates that he's managed to find, nowhere is it available who are the World Health Assembly number 75 delegates going to make these decisions on our behalf in a couple of days' time. And even on that basis alone, these amendments should be completely rejected, because without public participation, you cannot speak of democracy. And these decisions are not only unconstitutional, but they are invalid and unlawful. And now there's, of course, a global, growing, exponentially campaign, not only against the IHR or the new pandemic treaty, but there is a hashtag that's growing exponentially, and that's called hashtag Stop the WHO.
Hashtag Stop the WHO. Well, and that you've hit the nail on the head. Really, what we're talking about here is authoritarianism versus democracy, or representative republics like here in the US. Even if you assume that it's all good intentions and they mean well, you still have the problem of stripping citizens of their rights, right? Even if it's for the greater good, is that the way we're going to go as a global society, if you will? So it's going to be fascinating to watch. Now, and I really appreciate you coming on. So I want to let our audience know that you're going to be attending an event here soon. It's called the Better Way Conference in Bath in the UK. And it's also going to be online everywhere around the world, where they'll be discussing, among other things, the World Health Assembly event. So I would like for you to tell our audience what the Better Way Conference is, what's all involved, and what's your role there, and what are you going to be doing down there?
Thank you for asking. Certainly a bright light at the end of the tunnel. The Better Way Conference comes up from the 20th to the 22nd of May, so just before this big move at the World Health Assembly, which hopefully we managed to stop. And it is essentially, over 60 thought and action leaders from around the world coming together to co-create the better way for the better world. So one of my other roles is I'm on the steering committee of the World Council for Health, and I'll be hosting 2 panels. There's 7 in total over 3 days. On day 1, the panel is called Reclaiming the Science, because clearly we need to do that. And so I'll be co-hosting this panel with Majid Nawaz. And some of the panelists are Robert F. Kennedy, Robert Malone, Peter McCullough, Jessica Rose, Tess Laurie, Maria Hubner-Mogg, Brett Weinstein, Paul Alexander, Kim Witzak, and someone Charles News is very familiar with, Geert van den Bosch. And so we'll be looking at how we can reclaim science, not necessarily to ruminate on what's gone wrong, but to focus on solutions and how we can reclaim science together. Some of the other panels on day 2 include how to manage the health consequences of COVID-19, activism for a better world, redefining and revolutionizing the media. On day 3, which is Sunday the 22nd, I'll be co-hosting a panel with Paul Coupe from South Africa. And that panel is called Law, Justice, and Human Rights. And Adrian, as we know, those 3 words don't necessarily mean the same thing. No, so we'll be in conversation with lawyers from the UK, Philip Highland and Lois Baylis. We'll have advocate Dipali Oja, who's been interviewed on Trial Site News previously, from India, Javier Azalbert from France. We'll have a South African group telling us about their COVID-19 legal matters. And that includes Sabelo Sibanda, Bongani Lutuli, Kanal Lockenberg. We'll also be having Professor Dolores Cahill and Darren Diogi talking about sovereignty. Certainly, that is the word everyone's talking about right now, in particular as it relates to the WHO. And there'll be this very special spotlight with Astrid Stickelberger, who has previously spoken at the World Council for Health and used to work at the WHO. So she knows how it works and how important it is to resist. She'll be in conversation with James Rogaski, who I mentioned earlier on, and we'll be closing that panel with Rainer Kuhlmück. He's a well-known American-German lawyer around the world. And of course, 2 more panels to close the event. There'll be one on environmental challenges and the last panel on new ways forward for health. So essentially, this is creating the better way for the better world. Instead of focusing all our attention on what the other side is doing, is to invest our time and energy in creating a better world for the 99%. And tickets are available at betterwayconference.org.
betterwayconference.org. Well, Shabnam, thank you so much for joining me on the program today. As always, it's a pleasure and a thrill to talk with you. For those in the audience who would like to follow you, I know that you're on trialsitenews.com. Do you have Twitter? Do you have any other place that people can reach out and connect with you?
I do have Twitter, Shabnam Palesa Mo. I'm also on Telegram as SPM Media. I also have a Substack, but I far prefer publishing on Trial Site News. And of course, we encourage people who want to publish on Trial Site News to go to our website and sign up. There's a wealth of information out there amongst the public. And of course, Trial Site News is uncensored and innovative. So we certainly encourage people to publish content related to health and autonomy on our platform.
Excellent. And for those of you watching in the audience, as always, thank you so much for joining us. And of course, we will be keeping you posted on this story as it continues to develop. And so, my friends, that brings our program to a close. As always, thank you so much for joining me on the show today. From Trial Site News, I am Adrian, and I will see you all next time.